before I will do presentation to you, I have a question. So I mentioned many times, yeah, that we are going to talk about addiction, and addiction is a very popular topic and phenomenon, but maybe you know something about addictive behavior. And what do you know about addictive behavior? What does it mean for you, addiction and addictive behavior? So the root in this word addictive behavior is addict. This is English word addict. What does it mean for you? How do you understand this phenomenon, addictive behavior? Maybe you can give some examples of addictive behavior. Mm.
Things that you cannot stop.
Things that you can,
Uh,
okay, yes, okay. Uh-huh. For example, what you can stop.
for example, drinking alcohol, maybe using drugs, maybe, or
Okay.
some, um,
Alcohol, drugs,
Also, yeah,
Alcohol, drug
using
addiction.
gambling,
Mhm.
or nowadays very popular spending too much time on video games or social
Yes.
media.
Video
It's
games,
kind of
social media.
addictive behavior. Like when you keep doing or someone keep doing something
Mm-hmm.
over and over for a long time, even if this hurts himself, herself, and around people, causing problems, and they don't know how to stop it.
Mm-hmm. Yeah, that's true. This is kind of main thing in this addictive behavior and this phenomenon that we can't stop to do something. Yeah.
Mhm.
If even
Yes.
I want to stop, sometimes I can't do it. And Alana is writing to us. Yes, it is a pattern when we're doing something, and it's another kind of thing very useful for addictive behavior for definition. She says that we give some pleasure or relief when we do it. So this is also kind of some of key things in addictive behavior. Um, but you're right, all these things we now consider as addictive. But it's very tricky, you know. I do psychotherapy of addiction many years. Probably I have experience in this field about 20 years. But the word addiction came to our language maybe 30 years ago. Before we didn't talk about addiction. Now, when I'm talking about addiction, you're kind of defining, yeah, and you are giving me different types of addictive behavior, different examples. But before, you know, we were understanding this term a little bit in a different way. We used another term, dependence. You know that it's tricky Russian because in Russian it will be the same word, зависимость. So there is no difference when we are talking about addiction or dependence. We are talking about зависимость. But the word addiction came, not addiction actually, the term addiction came from English word addict. What does it mean to be addicted? Addicted. If to give some translation from English, please give the translation from English in English. I'm just joking, but anyway, I tried to kind of maybe to describe the meaning of the word addict. So you understand, yeah, this word addict, addiction.
Yeah.
you cannot
Yes,
live without it.
like
Huh?
It's things that you cannot live without it.
You can't live
Yes, addiction.
without it. You can't stop. Yeah, you told. Yeah.
yes, you stick to something,
Yes.
addict. Yeah.
addict, that means like a bad habit.
Stick, yes,
Yes, it's like
stick or holding to something.
Yes, and it's like in Russian we say like a habit. Yeah, this word. So it's like a habit that not useful habit, if I may say like that. So I really kind of like stick here in something. And when I'm lecturing in Russian about this topic, I usually give this translation, yeah, like пагубная привычка, so the word addict. So the habit can be different, yeah, in that sense. But I mean, by how to say, by our human being nature, we are addicted. So I'm absolutely sure that some of you,
Need means
huh?
need.
Need. Yeah, we have needs, of course. We have desires, wishes. Yeah, but not all of them, they can come true, all our wishes and desires. But our nature, yeah, that we kind of very needy, and we can become addicted to many things. You just were describing before, yeah, start lecture, this behavior, eating disorders, yeah. So it's also kind of part of our existence. We can't live without food. If we don't eat, we can die. So we need food for eating. But some people, they become addicted to eat. That is why we kind of have this different diagnosis that connected with these eating disorders like anorexia or bulimia, yeah, these things. And maybe some of you have some habits and you are also addicted. Do you have, by the way, if you can share your experience? Not about alcohol or drugs. I'm joking. But maybe if you can. But maybe someone.
For example, I always like addictive with drinking tea.
Okay.
Yeah, it's getting like a habit for me. And also like I also like get received energy from like drinking hot tea. It's also for me like addictive.
Yeah, so drinking tea.
Yeah, not alcohol or not drug, but tea.
Tea. And
Yeah.
and when you drink tea, you kind of feel some
Yeah,
positive emotions.
yeah,
Yeah.
positive. Yeah, when I drink tea, I can like feel myself like energetic and I can relax when I drink tea.
Yeah, cool. But when you don't drink tea, how do you feel if you don't have a chance to drink tea?
When I have no like tea, maybe I can maybe a little bit stressed
Yeah.
because it's addictive. I have to drink.
Yeah, okay, yes, yes. So you
Yeah,
consider, yeah, this behavior. So you
yeah,
can
yeah,
see, yeah, this addiction that, yeah, I'm really addicted.
yeah,
If I don't drink tea,
yeah.
I become very stressed. Yeah, so some negative
Yes, yes,
emotions.
yes.
Yes,
Yeah,
yeah.
exactly.
Well, this is
Kind of example, right? It's kind of example.
yeah. This is kind of key
Mm.
components of addiction. In that
Yeah.
sense, you're kind of right. Maybe some other examples, maybe some other addictions we have here.
Relationship addictive, yeah?
Yes, it can be.
Maybe.
Yes, relationship. Yes, some people can't, yeah, live without a relation. Yes. And you gave also some examples of addiction, like addiction from social media, yes, gambling, video game addiction. So all of us, we know about these addictions, of course. But you see that people can be addicted from a relationship, from tea. Maybe some other examples you have.
Sleeping, maybe.
Sleeping.
Maybe
It's a good,
food
yeah.
addiction, Professor.
Huh?
Food addiction, yeah?
Food addiction, yes. Food addiction. Yeah, we were talking, yeah, about food addiction. Some people really like, for example, chocolate, yes, and they can't live without chocolate. So Govasil is asking us, addiction something which distracts you frequently, even it's not like alcohol. Yes. So the main idea, like Shergazi was describing this experience, the main idea of this addictive behavior, that my attention is kind of fixing on something. It can be food, it can be activity, it can be some substance, it can be, for example, alcohol, drugs, and nicotine, yeah, all these things. So my attention is fixed on these things. And if I, for example, do this activity or use this, I don't know, thing like tea or nicotine, it's very kind of weird comparing, but anyway, you have to understand the mechanism. I kind of experience positive emotions. And if I don't have this thing, I experience something negative. So this is kind of key components of addictive behavior. And I started to tell you that the term addiction came to our language and probably to other languages, but to Russian-speaking countries, it appeared, this term, in psychology and in psychiatry. In narcology, it appeared at the end of 80s when two scientists, actually one of them, he was from America and another, he was from Russia. So American one, his surname is Sigal, and Russian one is Korolenko. They kind of gave the definition of this term. Okay, let me start presentation. Okay.
And Professor, I think also like these days, like teenagers, kids getting addicted with the smartphones, right?
Yes, yes. So
They are
this,
too addicted with using smartphones, like watching reels and also playing games, kind of video games. They are too addictive, like stick with this social media too. This is the negative, I think, side of addiction.
well, it's a good question because if we are talking about addiction, yeah, it's how to say, usually we see these things in a negative way because the word addiction, so the key components, it's not only be fixated on something, but the key components of this diagnosis that it has to be not useful for us. So it has to harm us. So this type of behavior has to bring us harm. And
Negative sides, right?
yes, it's like, and that is why this is diagnosed. So that is why I'm telling you before, for example, in psychology, in psychiatry, I mean, in some other science, we were talking about another term, we were talking about dependence only. Dependence, and that was usually about cigarettes, alcohol, drugs, some toxicomania, probably you know, yeah, this kind of term also, it's an old one when we could use some toxic elements. So the main idea of this word dependence, this term dependence in clinical psychology, in psychiatry, was about chemical addiction, chemical dependence, something connected with substances. But as you mentioned, now we have a lot of different type of this addictive behavior because, as I mentioned before, our nature, so we're very addictive, in that sense. We can Nurzada was telling that we have a lot of needs, and in that sense we can to achieve some positive emotions through fixation on something, and sometimes it can be drugs, but not always. And then some people that are talking about positive influence of addiction. So if we are talking about, I don't know, sport and something like that, if I may say like that. But this is not a diagnosis, because we are kind of we will try to talk about diagnosis. So according to this two scientists, addictive behavior, this is form of destructive behavior. You see, this is another keyword here, destructive. It has to bring us some destruction. And this destructive behavior characterized by desire to escape reality by altering one's mental state. So the main mechanism in addiction, so according to this definition, that we can't cope with something, we can't cope. And that is why we become addicted. So the main mechanism, I'm escaping the reality. So this is one of the coping mechanism, how I can coping mechanism, how I can deal with reality. So did you get this sense? That is why I kind of do sometimes very
we can
harmful,
control, right?
yes, harmful things, and I can't control. So the first stages, of course, if you start something, I mean, it's not always addiction. So it can be just something that I do often, or like your example with
And the
tea.
habits, right?
Yes, it's a habit,
Kind of
like
habits.
yes, and like your example with tea, because it doesn't harm you. So that it doesn't bring you distraction. But if you drink a lot of black tea or a lot of green tea, because it also has some, how to say, some
Harmful sides.
substance, yes, it can influence
Substances.
also, because some tea components, they kind of contain some caffeine. And if this dose will be very huge, you can experience
It
some
affects,
altered state. So did you get this idea about this?
true.
Yes, about this addiction behavior. And this is kind of key components here in addiction. So I mean, there are a lot of key components, as you can hear, but the mechanism, you are escaping from reality. That is why we use this strategy. And my mental state is changing. So this is altered state. And another thing, I experience very intense emotional development. Emotions. This is very kind of strong side of these things. So did you get these things? And do you have questions? Did you get?
Yeah, it was clear about addiction.
Yes, and before, as I mentioned, we were using the term dependence. And dependence, according to World Health Organization, you see this definition was made in 65 of last century. So the definition was, it's like dependence. It's a state of periodic or chronic intoxication produced by the repeated consumption of a natural or synthetic substance. Okay, understand? So substance, that means drugs, alcohol, nicotine, or some toxic elements like gas, maybe. I don't know if you had such experience or not, but when I was small and I was at school, it was very popular, in Russian-speaking countries to smell sorry, I don't know this English word, the clue, moment, clay, sorry, so the clue, yeah?
Glue.
Hmm?
Yeah. The glue.
Moment.
Glue. Yeah, sorry, glue. It's a moment. I don't know if some of your classmates did like that, but I remember that at my time at school, it was very popular to smell it. Some people were smelling, petrol, gas, and the kind of some paintings for the wall, they also contain some component that can change your altered state. So in last century, we were understanding by dependence, so this thing that got connected with chemical elements. But as you mentioned now, and you understand, the things already, you gave us a lot of examples, so that now we have a little bit different understanding. So we have some substance-related disorders, and we have some different types of behavioral addiction. As you were mentioned, like video gaming, gambling, like shopping. It's also, by the way, one of the type of addiction. People like to buy something. Or some, I don't know, internet use and etc. So a little bit different view, on these components. Okay, so if to talk about diagnosis, but not just some examples of addictive behavior. So diagnosis that we have now in ICD-11. Why I'm talking about ICD, I was telling you several times, because we are in Central Asia and in European countries and all Eurasia continent, we use this classification, for diagnosis. But if you are staying, for example, at the United States, they have their own classification that has name DSM-5 now they use, and China, for example, they also have their own classification, and there are some different symptoms or syndromes in Chinese classification. By the way, it's very interesting. But anyway, we are talking about ICD now. So what we have in ICD, if we talk about chemical addictions. So we have alcohol dependence, we have drug dependence, we have tobacco dependence or nicotine dependence, and we have prescription medication dependence. Well, did you get this idea? It's very, I mean, in that sense, kind of can be easy, because the word chemical, that means some substance, some element, some chemical element, And you know that, for example, in America, in United States especially, it was about 15 years ago, I believe, there were very popular term they were using when they were talking about chemical addictions. They were using the term Generation RX. Have you heard about this term before? Generation RX. RX.
I never heard about this.
Okay, RX. But maybe you can guess, by the way, guys. It's easy. Maybe. Generation RX. Try to guess. But not sure. If you are not, I mean, if you didn't have experience to be in the United States, probably you don't know. Okay, the idea Generation RX. RX, these letters we use when we prescribe some medicine. So these letters using on receipts. RX. Understand these things? So it was a huge problem that people started to kind of use some pills that they were prescribed by their doctors, not to reduce, for example, their own pain, but they really became addicted. And this is the policy of some pharma companies, that they prescribe a lot of receipts, and this can maybe see also the cause of dependence. In our countries, we don't have so much receipts, so that is why it's not a huge problem with Generation RX. But in the United States, it was a huge problem 15 years ago. Now I believe it's more, because I know only old statistics, for one person, they were prescribing 4 receipts per year for one person. So, I mean, everyone was taking medicine there, pills and some medical, pills, medical tablets. I mean, something that the idea we have to use for treatment. And that thing about the main thing actually about drugs, for example, that drugs, they were invented because we wanted to reduce the pain. So that is why we were using drugs before. But as I mentioned before, and you already know, we kind of tend to be very addicted, and that is why all this medicine and all the things we can use in a different way, and we become very addicted. So it's not always about medicine, yeah. And if to talk about non-chemical, addictions, so if again we keep this line about diagnosis that we have in ICD-11, it's gaming disorder, gambling disorder, and internet addiction. But it's not like how to say proper and pure diagnosis, because they have some different codes. But the idea, gambling, that means casino, gambling. Casino, it's not necessary to play casino now physically, you can do it virtually. And for example, internet addiction, gaming addiction, it's more known like addiction from video games. Before we had different terms also. Internet addiction before was divided on 5 types of addictive behavior. Like we were able to play games, we were able, I don't know, to buy something. It was also considered like internet addiction. And we were able to be addicted from cyber sex. It was also part of internet addiction before, and etc. But now we have in ICD-11 the addiction from video games. So not computer addiction, but addiction from video games. And it's very, questionable diagnosis, not quite questionable, sorry. So there were a lot of discussions about this diagnosis. Not today, later, maybe next lecture, I will tell you about video games and computer addiction, because my scientific work was about computer games and virtual reality. And several years ago, when this diagnosis was a huge discussion, that people decided to put this diagnosis in ICD-11, and the scientists, they were kind of divided in 2 camps. One of them, they were kind of telling, yes, there is such type of diagnosis like addiction from computer games or video games, but another type of scientists, they were telling, no, there is no addiction from computer games, because now video games, they are part of our reality. And I was on the side of the people who were telling that there is no such diagnosis. But we will be talking about this later, not today. But what common features we have in all these different types of addictions, chemical and non-chemical? You mentioned, this thing that if I do something, or if I'm addicted to something, I can't stop, so I can't control it. And it's also very difficult, to treat addiction, because if we are talking about diagnosis, we never tell that the person recovered, that the person is healthy now. So if you have this diagnosis once, it is kind of forever, because when you stop using something or stop doing something, we are talking about remission, that we are telling that you are in remission. That means at any kind of stage of your life, you can start again, because it's very tricky diagnosis. And it is connected with this things like compulsion. We discussed, I believe, these things before when we were talking about obsessive compulsive disorder. Remember, we were talking about anxiety disorders. So the word compulsion, I mean, do you understand, the word compulsive use, compulsion, what does it mean? Compulsion. How do you understand this word? Compulsive use.
Это внезапное появление, да? Компульсивное.
Yes, it's something. It's not like that it appeared from nowhere. So usually we have some obsessions. Obsession, that's thoughts about, I don't know, I want to drink, I want to smoke, I want to read something, I want to watch a TV show. It also, yeah, very kind of now popular to watch TV series and be addicted from it. So this kind of in my mind, but compulsive behavior that I kind of act these things. So I do something in reality. So it's not in my head. Compulsion that it's like without control. For example, I was thinking, and it's like compulsion. I immediately just go and, for example, take alcohol, or I go and drink tea. I go and I don't know, smoke. I go and do sport, so I can't control it. Yes, and Alana says, yeah, it's like some automatic or driven by anxiety actions. Yeah, and obsessions, these obsessive thoughts, it's usually connected with anxiety. When you're very anxious, of course, you have a lot of thoughts. Obsessions, you have to understand that obsessions have everyone, and sometimes our behavior in some cases, so we can be compulsive sometimes. I don't know, if you're hungry, for example, and you kind of didn't eat from early morning, you kind of were doing something very urgent you have to do for work, and it's like one moment you kind of can't already sit and do this job, and you just go and eat. Yeah. I mean, it's, if I may say like that, but this is example of compulsion. Okay, did you get, yeah, these things? Another, yeah, common characteristic of this addictive behavior, it's loss of control. You kind of telling, yeah, this thing, so I can't control it. I think I don't need to explain, yeah, these things here. And the third thing we discussed already, that this behavior brings me harmful consequences. So in spite of understanding, for example, that smoke is not good, I continue, yeah, to do it. And, sometimes, for example, I don't have money to buy cigarettes, but because I am addicted, yeah, I kind of take last, I don't know, money for this cigarette and go and buy it. Because it's like a compulsion, and I know this is not good. Yeah, for example, maybe it was my last money, and I won't eat bread. I don't have food, but I kind of spend this money for taking cigarettes, or you know, maybe these stories we can hear them often when we are talking about gambling. Yeah, when we are talking about people who play casino, they kind of lose a lot of money. Yeah, so they can't control these things, and usually that's they kind of huge amount, yeah, of this money, huge amount. So did you get, yeah, these things about,
yeah, we got it.
key components? Sorry, I don't always show you in the presentation. Okay, I have to share the screen. Maybe you have some questions now. If not, okay. So here we can see the understanding of this diagnosis ICD tells us, ICD-11, yeah? So addictive behaviors, substance-related disorders, and impulse control disorders. So all these things we have now as diagnosis. I'm sorry, I don't know about DSM, but if you're kind of interested, you can have a look on these things. And as I mentioned before, China has their own classification, but I didn't look at this classification because it's really interesting to look. Maybe in the next lecture, if I remember, I will have a look and tell you about these things, because you know China has a huge problem with video game addiction and with gambling addiction. Probably you know, yeah, these things, and they have a lot of research on this things on addiction, especially on computer addiction, but they kind of do it a little, I mean, they do treatment in a little bit different way. They, for example, than other countries do. You were asking me about treatment, yeah? Not addiction, but other diagnoses. But anyway, we were discussing that usually we use some forms of psychotherapy and we usually some medicine, yeah, that we are describing to the person who has some diagnosis. But what China does when they do treatment of video game addiction, it is usually happening with teenagers, yeah? They take teenagers to some camp. Maybe you saw these videos when they live in these camps without any gadgets, yeah, without even mobiles, and it's and they do some work there. So idea of therapy in China, for example, they try to show them the different activity they can do, not only to sit and to watch on the screen, but some work, yeah, they do. And sometimes I kind of remember about Soviet times. I mean, I have heard it from my parents, of course, when they were telling, it's like, if you don't work, you have a lot of kind of thoughts in your mind and everything because you're lazy. If you do work, so nothing is happening with you. So it's better to do work. So China had this strategy. Did you get this idea about addictive behavior, addiction, and how this term, it's like an evolution of the term. Before we were talking about the dependence, now we are talking about addictions. Do you have some questions?
Yeah, it was very clear. Everything is like understandable.
Okay, so because I want to continue, not start, actually to start to
I
talk about.
mentioned the example, right, about video gaming. So it's also true, right, about addiction.
We have such a diagnosis in ICD-11, you know, that a video game, it's addiction in ICD-11.
Addiction.
In ICD-10, we don't have such type of diagnosis. But it's still, you know, discussion. It's still the discussion still continues between people. For example, now I'm working on a paper. I didn't finish it yet, but I finished my research. I was repeating research that I made 20 years ago. And some results similar, but what I can see now that video games, they are part of our reality now. So it's very difficult, you know, to talk about this border between addiction and between, you know, cultural component. Because when I first did my research on addiction, we didn't have computers. So that is why it's like, oh, if I play, I kind of spend a lot of time in these computer clubs. I still sometimes, yeah, money from my parents. I don't go to school and I play a lot. And it was very harmful, yeah, for behavior. So this component of addictive behavior. Now we can have such cases, of course, but usually if I see such people, because sometimes my colleagues ask me to have a look on this patient who has computer addiction. Usually, the cases I saw, I don't know, maybe there are some others, of course, but usually it's another diagnosis. I mean, there is comorbidity, this term. Several diagnoses goes together. So video games, it's not priority. So this person has some other things also, and it's very difficult to say what is main thing.
Yeah, because these times like schools like banned using mobile smartphones, right, at school. In that case, some students like teenagers getting stressed, getting maybe depressed because they cannot use smartphones at school.
Yeah, that's true. Yes. And that is why it's very questionable. For example, now I tell that, okay, it's a question about addiction. But when I did my PhD, for example, 20 years ago, I was writing, yeah, this is addiction. So you see, everything is changing. And because all of us now, most all of us, we have computers at home, it's very thin, you know, border between what is addiction or not. But in most cases, I think it's more cultural phenomenon because, for example, many centuries ago, we didn't have books. Yeah, and when books appeared, some people also started to read. And, there is also some, in that sense, addiction. It's not a diagnosis,
Addictions,
but some addictions,
yeah.
people like reading, and, they live for these books, they kind of
Newspapers also,
yes. So
they
in that
all, yeah,
sense,
I think so.
the mechanism, but you should understand the other things that it's if we are talking about addictive mechanism, I was mentioning the other things before, it's about escaping the reality. So if I can't cope with something, I prefer to be somewhere else, but not here. So that is why video game addiction is a very questionable and discussionable topic, but I will talk maybe next time about this topic if you are interested in. But today I wanted to actually continue to talk about alcohol addiction. So that was, I wanted to start talk about these types of addiction, and I wanted to start from
All
this
right.
alcohol disorder. Okay,
Okay.
are you ready?
Yeah.
What do you know about? Yeah, I mean, not do you know, but some.
Actually, I
Uh-huh.
never experienced with like alcohol. Like
Oh,
I never
okay.
tried. Yeah,
Oh, okay.
but cigarette I tried, but I don't use like smoking, and
Okay.
I really don't interest like using alcohol.
Okay.
Mm.
So you don't have experience, but other people, I mean, maybe you have
But
experience to use
I
alcohol.
have, but yeah, relatives that they are using alcohol in their daily life. Maybe it's very interesting topic for me too.
Yes.
Mm.
Because if we are talking about drugs, for example, usually it's like it's forbidden. I mean, it's forbidden by law. You can't use drugs, yeah. But with alcohol, it's a little bit different situation. Alcohol we are using, I mean, human being, humankind, all humans, we don't drink only this century or last century. So it's many centuries people drink alcohol. So we use alcohol. But in some countries, it's forbidden. But in most of the countries of our world, it's allowed. So it's not like the sin that's something a criminal I do, yes, if I drink alcohol. So that is why this diagnosis, if you become addicted, it's not necessary to become addicted, yeah, from alcohol, but it's very popular diagnosis, alcohol and addiction. But other people, I mean, other guys, do you have experience of using alcohol?
Using alcohol, you are using alcohol for relax,
For relax?
and yes, and sometimes you are using alcohol to run out from your problems. So I think people use it to be in relaxing position. The people that don't want to see reality, real situation, problems. Maybe that's why. Then they are addicting to alcohol.
Yes, it's like you told. We using these things to escape the reality, but we not always. How to say? Not always. We don't always understand that we trying to escape something. So usually we drink alcohol. I don't know, on some holidays, on some birthdays, some events. And. You were mentioning the things for relaxing. So the main
Yeah.
mechanism of alcohol is to bring euphoria.
Yes.
So understand, this. So this is kind of main mechanism. So that is why people for many centuries we have this experience to use the alcohol to feel some joy. Yeah. But in some cases, I don't know if you can maybe saw some people that were drinking some alcohol and it brings them not positive, sorry, emotions, but it's opposite negative feelings like dysphoria. They become sometimes very aggressive. They start to cry or something like.
Yes.
I mean, did you see such things before?
Yeah, of course.
but you have to understand that this is not like a usual thing, because this substance, if again, I'm repeating, if I use alcohol, the main idea, if everything is okay with my nervous system, I have to experience positive feelings like euphoria. I mean, you understand, yeah, the term. But
Yes.
if I use alcohol and it's opposite, that means not typical thing. That means I have some, I don't know, problem. Maybe I was sick before, and I'm kind of my nervous system is exhausted. I have asthenic syndrome, yeah, or maybe I have some other diagnosis, yes. And I remember when we were talking about different diagnoses, we were discussing psychopath, yeah. Psychopath is, I mean, this is old term that used in psychiatry, but usually if we talk about psychopaths, yeah, and these people, when they drink a little bit alcohol, they become very impulsive, so they can't control themselves. And usually it's about psychopathy, yeah. No, it's another type of diagnosis. We don't call it psychopathy, but understand, yeah, these things. So if you drink alcohol, it has to be your state has to be euphoric. If it's opposite, something not usual, some other diagnosis you have.
Yeah, when we are using alcohol, we are in relaxing position. Someone can control their sensations, someone cannot. And of course, maybe I will continue in Russian. Некоторые контролируют, и те, кто, видимо, те, кто воздержался от своих чувств, да, против вот этого как раз релакса, они вот это все, видимо, выливают. А у некоторых они используют алкоголь, чтобы как-то скрыть свою боль, избегает реальности. И со временем, видимо, как раз-таки происходит процесс аддикшена.
Yes, it's exactly like that.
Постоянно.
Yes, because I start usually from time to time, then it become like a habit, a bad habit, as we were discussing before, and we are talking about systematical use. But the idea, I'm just trying to tell you about alcohol at first, yeah, that you have to understand that usually people drink and it has some influence on our psychological state. We go to altered state, and there are different stages, yeah, of this intoxication. So if you drink, I don't know, 50 grams of strong drink, you can not, I don't know, become like oh, you don't understand where you are, you're still controlling something. So usually it's different stages of this intoxication, but you have to understand that if you drink a lot of alcohol, so you can die from this intoxication. So it also can be dangerous. And as you mentioned before, using of alcohol connected with this feeling of control usually. Yeah, because when I drink, I go to altered state. I mean, it's a normal thing to use control, not to lose, sorry, control. And if I drink more, it goes to the next level of intoxication. My control is like decreasing, and in some stages, like second stage, yeah, of this intoxication, people even can't walk properly. Yeah, it's like they walking like and they falling. Sometimes if you kind of overdose, you feel very bad. Yes, I have this vomiting, and all these things. So this is kind of defense mechanism of our physiology. But you know, some countries, if to talk about culture of drinking, some countries they really have this like a habit. I don't know. It's like a culture. Yes, like Georgia, for example, Spain, Italy. Yeah, if you go there, it's okay to have some wine during lunch, brunch, dinner. I don't know. Georgian people also very famous, yeah, with wine, and it's very tricky also how we can divide, yeah, this kind of just cultural scene or person became addicted. But I mean, even if it's part of your everyday life and it's allowed to drink, some people they can become addicted from alcohol. Some they don't become
When I was in Georgia, there was a guide. He said You can get Georgian citizenship. If you love wine, you can get our Georgian citizenship. Just one thing, you must love wine.
Wine, yes. Wine, and they are telling also, that red wine is very useful for blood. That is why you can't drink it a lot. So only one glass of red wine is like for health. I don't know. It's very tricky because sometimes people are asking these questions when and how we can become addicted. So how many milligrams we have to drink or we don't have to drink. So I mean, it depends. I may tell the sense it depends on the person because it's often seen when we start drink, as you were telling before, when we start drink, when we try to escape something, when something bad is happening, some stress situation, and I'm trying to go to this altered state. I just want to improve my mood. Sorry, and that is why I drink. But for example, I drink and next days I still feel, I have this feeling that, I have bad mood. This situation didn't kind of solved. I still have stress. Okay, maybe I will drink again, and I drink euphoria. This euphoric effect. I become kind of more relaxed. I tend to forget about these things, and these episodes I have. And the next stages is like I do it more often. Yes, and then it's systematically used. And depression and use of alcohol usually goes together. So sometimes people start drink when they have this diagnosed depression, and after they have this another diagnosis, it's again about comorbidity that they have also alcohol addiction. But there is also another thing because it's about physiology. When I drink, I don't know, every day. Sometimes such situations may happen, in some cases, like, I don't know, some maybe business meetings, some organizations, some businessmen, they use this, things. It's like ritual. If you don't drink with me, I won't sign a contract with you. So there are some situations when people tend, they have to drink, I don't know, for a couple of weeks, for example, because they have to sign a contract. It happens. It happens sometimes. And I don't have, for example, any stress, except I have to sign the contract. But anyway, if I don't have any stress, but I drink because I have to. So 2 weeks later or 3 weeks later, when I stop drinking, because alcohol already starts to be part of my kind of body, my physiology, this process that I have inside. In that sense, like exchange processes, of my body, I feel a little bit bad, and I can have sometimes depression, not like really diagnosed depression, but if I drink more and etc., sometimes alcohol leads to developing of depression, the diagnosis, depression. So did you get this idea? It's very tricky in that sense with alcohol. Okay, and we have to look a little bit on kind of again on developing of this term, because now we don't use this term, but if you can see here, and in Russian-speaking countries, we were using before the term alcoholism. Sorry, have you heard this term before? Alcoholism. Now we don't use this term, but this term first appeared in 19th century, as you can see. So comparing to other addictive behavior diagnosis, this was kind of the first one. Yes, and it was 1849. Yes, and almost 100 years, the using of alcohol, the attention of doctors was on physical symptoms, on physiology. So they were describing these consequences of heavy drinking that usually connected with my body, my physiology, yeah, not like something happening with my psychic or psychology, but usually it's about physiology. But I mean, it can be, of course, explained because the term psychic, not term, the concept of psychic, of psyche appeared, psychology appeared then and the ending of 18th century. Of course, the focus was on physiology more in that sense. But later, after 1940s till 1970s, yeah, people, scientists, they were starting to talk about this feeling of losing control. Yeah, that I can't stop drinking. So the mechanism of addiction and dependence developing when, for example, I drink, but sometimes I can't stop, yeah, and I can control the quality of the things I drink. But kind of next stages or next level on, for example, when I really become addictive, I don't control what I drink and I can't stop. So if it will be several bottles, or I don't know, whatever, wine, beer, vodka, whatever, so a person can't stop. So he's losing this control. And scientists started to explain the diagnosis that some biological things kind not good, yeah. So some biological anomaly, yeah. And only in 1979, yes, that term appeared, yeah, alcohol dependence syndrome. In that sense, now again, I'm telling you that we have such type of diagnosis in ICD-11. So it's a little bit different, not different, there are several diagnoses, not only about alcoholism or alcohol dependence syndrome. Dependence syndrome, this is key word here, dependence syndrome, because this syndrome can be in substance use also. But now we have alcohol use disorder, alcohol dependence, hazardous alcohol use, alcohol-induced neurological complications, alcohol-induced mental or behavioral disorders. So sometimes it's not only about addiction, but some consequences when I use alcohol, it can be some psychosis, if to talk about diagnosis. Did you get these things? Again, if to continue this idea to talk about diagnosis, so actually the doctor has to put this diagnosis to you, but you have to have at least 3 or more from these syndromes. Strong desire, yes, so it's like really I have this not even wish but desire to drink, to take alcohol. Impaired control, and I have withdrawal syndrome. Do you know this term, by the way, withdrawal syndrome? Withdrawal syndrome. I will tell later, but maybe you know. If you don't, I have to explain here now. Withdrawal syndrome.
No, I think.
Syndrome отмены. In Russian, we say abstinenция. So it's like abstinenция with abstinenция. So it's Russian word. Withdrawal syndrome is when I don't use alcohol, I have some literally physical consequences. Like I feel sick, I have headache. Sometimes I experience this temperature in my body, vomiting. Yeah, my mood is not good. I'm very anxious and all these things. So in Russian language, we use this term похмелье. Sorry, I don't know the English term. Its official name is withdrawal syndrome. But if you have this withdrawal syndrome, usually people say that you already have addiction from alcohol. Because if you don't have this withdrawal syndrome, usually you're not addicted. I will talk about this later a little bit, but now we're talking about syndromes. Tolerance. Do you understand this word, tolerance? It's actually about different types of addiction when we are talking about tolerance. How do you understand these things? It's very, very common.
Yeah, it's like you said that some people they are used to ask that when we can become addictive. Yeah, the tolerance of our body, it's like the up point where after this point people become addictive, and tolerance below this point, I think.
So it's like, yeah, it's for example, if I usually drink, I don't know, 2 glasses of wine and I become drunk. So tolerance means that I drink these 2 glasses of wine, but I see that it's already doesn't have the same influence on me than before. So I become tolerated to this quantity of this dose. That is why I have to increase this in. Understand? Yeah, to become drunk. And on last stages, yeah, it requires more alcohol to become drunk. So this tolerance, the same thing is true about drugs also, nicotine, also these things. I need more of this substance. I need more of this activity to feel the same emotions I felt before. Okay,
it's
now.
Like yeah, it's like red line tolerance. No?
Yes, it is, but not all of us, we are paying attention to this red line. Yes, but that's true. Yes. Another symptom, yes, it's neglect of interest. So usually I kind of forget about other things, and I really want to have something that's connected with alcohol, or I'm looking this activity, or who has a birthday, oh, okay, Friday soon, we will gather with our friends and colleagues, and we have some kind of relaxing party, and etc. And another one is continued use despite harm. And I feel, for example, bad, as I mentioned before, I have this withdrawal syndrome. I have, I don't know, headache when I don't drink. I mean, next day I drink. But anyway, I continue drink. Or sometimes people don't go to work, but they anyway continue drink. So you get, yeah, so this is symptoms we have in ICD. So this is criteria. And if you have, for example, at least 3 from this list, and it has to last no less than 12 months period, then we kind of can talk about some syndrome of alcohol dependence syndrome, yeah? Understand? Do you have questions? Next one. But you have to again understand that these things usually diagnosed put by psychiatrists. Okay, guys. If you tired, we can have some break if you want. We can have 10 minutes break. Yeah. Okay. Okay, so we stopped on symptoms, yeah, of this syndrome. Do you have questions about things we were discussing? About alcohol, about alcohol dependence?
No question.
Okay, then I will continue. And this is really important. You also have to kind of understand, yeah, this mechanism. So we are talking about anyway dependence, yeah, dependence mechanism, dependence syndrome. And our dependence has 2 types, if I may say like that. So one of them is psychological dependence. Maybe you have heard the term. And another is physiological dependence. Did you hear before this things? Like not like physical and psychological, yeah, if to be more
Yes.
clear. And how do you
I
understand?
know about dependence, but I don't know about their types, like physical and psychological.
Yeah, physical, which related to our body, yes, like maybe to our sleep, to maybe our weight, maybe like appetite, like this, and psychological, more like our emotions, our like mood changing, feeling anxious, depression, guilty, maybe somehow like this, maybe.
So, for example, if I start to develop some addictive pattern or dependence to something, yeah. So usually my dependence syndrome consists of these two, psychological and physical. And you were describing, yeah, this is only, I mean, just now that psychological is something about psychology, emotions and etc.
Yes.
Physical is something with body. But how do you think which of these parts starts to develop first, physical or psychological, or it goes
Psychological
together?
term, I think.
Psychological.
Psychological, yeah, kind of habits in our brain, then we can physically do.
Yeah, in our brain that we can psychological. Okay. Other
Maybe another
ideas.
side also, we can also have like physically, then adapted, kind of, then the psychological habits can develop maybe. Just idea.
Okay. Some other thoughts and ideas. So Shurgazi thinks psychological dependence starts first and then physical.
Maybe like physiological, I think, because it's like maybe it's like related to genetics. Maybe it's also genetic factor can be effect on it. So we can like together say it's physiological, then it will bring the psychological outcomes.
Okay. Other ideas, thoughts? Actually, psychological dependence goes first, of course, because you see, if we are talking about alcohol, yeah, but this is about all, yeah, different types of addictive behavior. But anyway, if we talk about alcohol, as I mentioned before, we were discussing, yeah, this is before I drank, for example, once when I felt not so good. I was stressed, yeah, and I felt easier. So next time when I become stressed again, I have this idea in my mind that I want to drink. So my body doesn't want like my mind want, if I may say like
Yeah,
that.
feelings want.
Yes, like it's like really I desire,
Mm.
yeah, and
Mm.
I really I desire. It's a good word, but it's not like I
Mm.
wish. Maybe at first I wish, then I desire, and there is also another, yeah, kind of English word. It's a good word. It's craving. Yeah, it's intense craving.
Yes.
And this is how we can see the psychological dependence. My body maybe still doesn't have the alcohol like part of my physiology, like my physiological physical activity. Yeah, but in my mind, I keep this in mind. I want, yeah, to become relaxed. I want to forget about maybe some problems, and this is psychological dependence. And then when I do it many times already, yeah, in that sense, alcohol already becomes start to become very important part of my body. Or if we are talking about some drugs or medicine, for example, pills, yeah, that made, of course, also on the base of drugs like painkillers. So if I, for example, have some pain, physical pain, I kind of start to use this medicine. I feel much easier. My mood is okay. So next time I feel pain, I have the psychological idea that I want to reduce pain, but maybe I'm very, how to say, in that sense, patient, and I don't try to use medicine. But if I use, so, and these painkillers start to be kind of part of my body functioning. And next day, for example, if I don't take these pills, my body feels very bad. So literally, yeah, this withdrawal syndrome. Okay, so did you get this idea?
Yeah, it's getting like addiction again.
Yeah, it's a physical dependence. So you have to understand what I'm trying to tell you. So this addiction mechanism, or if we use another word like dependence syndrome, consists of two parts: psychological dependence and physical dependence.
And
Yes.
it's like cycle, yes? Another one calling, another one like cycle.
It's how to say, the first thing that appears is psychological dependence, and the second thing that appears is physical dependence. And psychological dependence never disappear, never. So that is why we don't talk about the person who suffered from some diagnosis from some addiction. We never tell that he recovered. We kind of tell this person in remission. Because psychological dependence is really, really tricky. But why do you think it's like, or maybe you don't agree that it's tricky? Maybe you think psychological dependence.
Maybe this pupil who was addicted before, they know these feelings, yes, how they were maybe in this relax. That's why they cannot forget this. They couldn't forget this feeling. That's why they want again. That's why psychological will never maybe treat it or cure it totally.
Yeah, so that is why it's like I really craving. I really have desire, and this desire in my mind, and I can't feel it on my body. You know that if to talk about psychotherapy of addiction, to my opinion, yeah, and some of my colleagues also think like that. So chemical addiction is a little bit easier to treat, because they have strong component of this physical dependence. And as you can see, this physical dependence is like key indicators that your body already addicted. You have this physical dependence, that it's tolerance, yeah. You need more dose, yeah, of any elements, and this withdrawal syndrome. And if you kind of use this element, you become kind of feel easier. And in that sense, if you literally feel something on your body, this pain, for example, my patients with drug addiction who are in this withdrawal syndrome, some of them, they prefer even not to use some medicine for reducing these withdrawal symptoms, if even it's very painful. So I don't know if you, for example, imagine that you suffer from flu, I don't know, COVID, for example, some very heavy symptoms of COVID. I believe you experience these things. So if you can have this withdrawal syndrome, it's much more stronger than these symptoms of COVID. So your body literally in pain. And when you feel something on your body, in that sense, of course, it's, to my opinion, it's a little bit easier to cope with this craving, with this desire on psychological level, because I don't want to experience this pain again, literally. I don't feel it again. That is why probably it is a little bit easier to do psychotherapy of chemical addiction. But if we are talking about gambling, then in that sense, physical syndromes are not like like that. Yeah. So everything is about psychology. Maybe they have some, I don't know, syndromes, like, I don't know, but I even can't tell like that it's a physical syndrome. It's a psychological dependence, of course. So it's mood changing, yes, and it's depression, anxiety, and etc. That is why it's more difficult to treat such type of addiction, non-chemical, because it's about psychology, yeah, if I may say like that. So did you get this idea?
Yes.
And it's like a stages, yeah. So if you have
Yes.
this withdrawal syndrome already, tolerance, it's physical dependent, then that means you are addicted, or someone you know is addicted already. So it has to be treated with medicine, because if we are talking about psychology, and if you just started to form this addictive behavior, of course it's much easier to stop, yeah, doing this when you are on episodes of doing or using something. But if you do it systematically, it's another thing. Do you have questions here? So did you get?
Yeah, we got it. No
Okay.
questions, I think.
Okay, yeah. Then we continue, yeah, because I want to tell you about this old classification of alcoholism that we were using in Soviet countries, yeah. Why I want to tell you, because it's really a good classification, to my opinion. We don't have such in modern classification, but what I like here, that these two specialists on drug addiction, Portnov and Pyatnitskaya, they were very famous in Soviet Union. They kind of describe the stages of developing of this alcohol addiction, and it's really kind of it can be useful if even we don't kind of use this in modern ICD 11 classification, but it can be useful because it may help you to see on what stage this person is now. So because it depends on which states you are, because there are some changes with a person who use alcohol depending on the stage. Okay. So they were considering alcohol addiction as a result of a combination of some genetic factors. So it can be legacy from your relatives, yeah, and some environmental things, so some stress situation and all this. So it's a complex phenomenon. So it goes together. Yes, and usually alcohol intoxication leads to decreasing your cognitive abilities, and that is why if you don't stop to kind of drink, it can influence on your life very severe, not only on your relationship, on your work, I don't know, some hobbies, some social things, but also on literally on psychology and on body. Yeah, you can suffer from dementia even on the last stage. So there are three stages according to Portnov and Pyatnitskaya. So first stage is like initial neurasthenic stage. Usually people on the stage, they have this psychological dependence only. They want to have alcohol, to change their state, to go to this altered state. Their tolerance is increasing, and usually they have some problem with sleep, yeah, and some emotional lability, and they have these changes in drinking pattern. So at first, everything starts in any addictive type of behavior, as I mentioned already, starts with episodes, and then we go to systematic consumption, to systematically use of anything. So first stage, when you already do it systematically, so that means we are talking about diagnosis already. So before, maybe it's just some using without any forming of dependence mechanism. And if you, for example, don't stop, you continue to drink, you go to next stage, yeah, So middle stage. The desire is increasing, and you know, because we are talking already, withdrawal syndrome is physical depends. Yeah, we are talking about intoxication, and that is why people on the stage, when they drunk, after they can't remember something. It's amnesia. Yeah, so if someone has such symptoms, it's already not good, because your brain started to suffer already. I told you that alcohol influence very strong on cognitive process on our neurocortex. And pseudo binge drinking, that means it's like I can drink starting, for example, from Friday to Sunday, but if I know that on Monday I have to be at work, I stop drinking. But anyway, every week for 3 days or 4 days, I kind of drink. And of course, alcohol targets some internal organs and our nervous system. And if the person doesn't stop to use, we go to next stage, it's final stage. In that sense, it's already development of binge drinking. That means it's not pseudo, sorry, it's a very Russian pseudo, yeah. It's really kind of binge drinking. So before, for example, I was able to stop drink when I knew that I have to work at on Monday. But on this stage, it doesn't kind of have any meaning. If I have to do work, or I don't have to do work. Anyway, I kind of drink, and this drinking can take sometimes several weeks. And maybe you have saw this notification sometimes advertising that will help to kind of to reduce your drinking, yes, to go out from this drinking. And actually, if your dependence mechanism already formed, of course, when you stop drinking, you need medical. I mean, if you stopped this binge drinking, but you need medical attention, because accidental stop, or not accidental, but if requiremental stop without medicine can cause you a lot of problem. You can die sometimes from some other disease, like I don't know, heart attack, blood pressure, and etc. Because we have already formed this physical dependence. Yeah, you have to understand all that is why it's really dangerous. And person who suffer from alcohol addiction has to be treated by medical specialist. Again, I'm telling you. And on the second stage, for example, it's increasing tolerance. You have to pay attention also on this thing. So person need to drink more quantity of alcohol. And usually this person on the second stage doesn't pay attention on quality of alcohol. But on first stage, they still kind of pay attention on quality. But on the stage final three, yeah, on the stage three final, sorry, the tolerance is decreasing. So it's opposite. Person, for example, who has this third stage, he drinks just, I don't know, 10 grams of alcohol, and he becomes very drunk. So because physiology and all these things, severe neuropsychiatric disturbances already, diseases of internal organs and nervous system, and frequent occurrence of alcoholic psychosis happens on this stage. And you know, it's very, very tricky, because we have like personality of these people on the third stage also changing. Yes, so if maybe I don't know, maybe you know someone in your life who is addicted from alcohol, because it's not very rare in our countries, also in our modern world, and probably you can see, yes, someone on these stages, and third stage is very, very, in that sense. So this is last stage, and you can't change anything. So intellectual ability is also decreasing on the third stage, and you can't restore it. So if you were, for example, I don't know, very clever, so on the third stage, your intelligence decreasing, and this is kind of once and for all. You can't come back. Did you get it? I mean, do you have any questions? Maybe you remembered someone now, yeah, and you want to share your experience about person who has different stage of alcohol, or maybe some other questions. But it's so the last stages is the last. And you have to understand also, by the way, I remember. So it depends on the person also. Some people require to go from first stage, for example, to last stage, I don't know, 20 years, 30 years. But some people require, I don't know, less quantity of years. It depends on the person, and there is also to some opinion on some of some scientists, there is a difference between men and women. Probably you have heard, yeah, about this things about alcohol addiction, about men
Yes,
and
women, they are more like struggling to become addicted. Yes, women.
yeah, some scientists, they tell that yes, true, that it's more difficult to do treatment with women, and they become faster addicted. And
Yes.
their body suffers faster than man's body. So if to kind of, if I and, for example, some men will start to drink together on one day, yeah, the same, I don't know, quantity. So on my appearance, on my body, it will be faster to see that I drink, but it's not always like that. Yeah, there is such opinion that it's more difficult for treatment. So that is why to go from one stage to another, usually it's very individual process. Yeah, I don't know, maybe you remember someone from your again your surrounding that you know this person drinks, I don't know, for 20 years and still, I don't know, maybe on the second stage. Yeah, so it also happened. Some people I have such not they were not my patients, but I know some people, they were kind of drinking before, and they had this kind of binge drinking, but something like happened, and I don't know, without any treatment. Some of them, they just stopped drinking, but they actually, of course, they were already older, like if they were drinking when they were young, but if there's near 70 now, so they kind of just don't drink for 10 years. So it happens with
They
some
are,
people.
yeah. These things, I think they need very big reason to give up from alcohol. I think, yes, I saw one like from our. I know one man. He gave up because of his beliefs. Someday he started to believe, and he learned that it's not allowed in his like belief, and he just stopped. And as you said, it's more like psychological, yes, like that's why this reason uh, overcome very many years, and he just gave up from quit from the alcoholism.
Yes, and it's very difficult if to talk about treatment. It's very difficult, again, I'm telling you, to do treatment of addiction. It doesn't depend on the school of psychotherapy or methods. I mean, disease by itself, diagnosis by itself, it's very difficult to stop, yeah, drink, I don't know, to use something.
And they are saying like this withdrawal, they want to give up, but this even they stop, and this withdrawal is very painful. That's why they to calm this their pain, they start to drink again.
Yes. Some people, they
Withdrawal,
can't.
painful withdrawal.
Yes, they can't, cope, and they don't want to suffer, and they continue, drink. And you know that it's very low percentage of not recover, of remission from drug or alcohol addiction all over the world. It's less than 10% of remission. It doesn't depend on the hospital, on treatment. I mean, the diagnosis by itself, it's very difficult. And when we do treatment of alcohol addiction, it is required to do medical treatment, again, as I mentioned, psychotherapeutic treatment with a person who suffer from this type of addiction, and with the nearest surrounding. Because if you don't do psychotherapy with so-called codependent people, it is not effective. A person who stopped drink, for example, he is coming back to the same environment and he starts to drink again. So it's requirement to do psychotherapy with his surrounding. Did you get these things? It's very important.
Yes.
And I want to show you some statistics I found today. So it's not official, the statistics of, I mean, it's official, but there are some unofficial figures, because we don't know always about official things about alcohol. But these statistics of WHO organization, so you see more than 3 million people dying from using alcohol and drug every year. Yes, from alcohol dies more than 2 million people. From drug-related deaths, it's less than 1 million. So you can see the figures. Men suffer from this alcohol more than women, just statistically, and 0.4 million drug-related deaths among men. The causes of alcohol-related deaths you also can see. It's like it's not only from using of alcohol, but it's something that goes near. It's some problem with cardiovascular, for example, or cancer, or some traffic accidents, self-harm, some violence, HIV, tuberculosis. If to talk about not only about alcohol, it's also about drugs. These things. And the liver, of course, are always in problem with people who drink alcohol. So you see that, a lot of people kind of dying from the thing that connected to alcohol dependence. And they were also, it was very interesting, they were kind of trying to calculate how many liters people drink alcohol. You see, by regions. So on the top, if I can see, it's like European region, they drink more, almost 10 liters per person. So the lowest, it's, as I can see, it's only America and Europe. There is no lowest countries here, sorry. But you can look on official web of who there is the statistics by country there. Okay, so and the gender, yes. So 30% of alcohol-related deaths occurs in young adults aged 20 and 39 years. And 23% among teenagers. So you see now the age of addiction becomes younger, to be honest. Both alcohol and drug addiction. So before, I remember when I just started my experience in this drug addiction treatment, the average age of a person who was drug addict, it was about 19, 20, 18, maybe like that. But now it's about 12 or 13. So alcohol also, you can see, become, in that sense, younger. Okay. Do you have any questions about alcohol addiction or about addictive behavior in general? Because we are talking about these things today. Is everything clear to you?
Yeah, everything was clear.
Yes.
Thank you very much. Have no any questions.
Yes, okay.
Just one moment here.
Mm-hmm.
We told about the dependence. Yes. We say that dependence come first, then addiction come. Yes.
No, dependence and addiction, this is like synonyms. Dependence, actually, this is old word we used, this is term we used mostly for chemical dependence. So dependence usually we use when we talk about alcohol, drugs, nicotine, and etc. But if to talk about addiction, so this is term that appeared at the end of 80s because people can become addicted not only things that connected with chemical things, yes, like non-chemical. And in general, addictive behavior can be chemical and non-chemical. So this is kind of the term like addictive behavior, addiction behavior. But usually if we to talk about dependence, it's a chemical one. That is why we talk about psychological dependence and physical dependence, because this is part of chemical addiction usually, or chemical dependence. So this is synonyms. Yeah,
Okay.
did you get
I got it.
Yeah. Mm-hmm.
Yes.
Okay. Okay, thanks for your questions, attentions. For today we are finishing.